This video is on mild cognitive impairment, which is a very important syndrome to recognise, as there are things that we can do that can prevent it potentially getting any worse and theoretically developing into dementia. So I think it's probably helpful to think about the different buckets that people can fall into when it comes to cognition and the aging brain. So in another video I've talked about the impact of age, and age certainly does have a detrimental impact on the structure and function of the brain and also cognitive skills, and most people will experience those issues. Then the next phase, if you like, or next category is something called subjective cognitive impairment. And as the word suggests, it's an awareness of some sort of cognitive problem that you may have yourself. You notice that your memory's slipping, or you just cannot remember things or problem solve quite as well as you used to. But the thing about subjective cognitive impairment is that we can't prove it to be a deficit on objective testing. So if you sat down with your doctor or a neuropsychologist and we went through cognitive testing, looking at your memory and so on, we wouldn't actually find anything that was objectively a deficit. So you think there's a problem, but we can't pick it up on testing. That's in contrast to mild cognitive impairment, which I'll talk about the details of that in just a moment. And then there is this concept, of course, of dementia, and not everybody will, of course, travel along this spectrum at all, but these are the different sort of phases that people potentially can go through. So coming back to mild cognitive impairment, so it is a very important syndrome to pick up because, as I mentioned at the outset, there are things that you can actually do to perhaps reduce the risk of it developing into dementia, and it does have an increased rate of converting to dementia each year, unfortunately. So if you are told that you have mild cognitive impairment, there is a 10 to 15% chance year on year that you will go on to develop dementia. And that's in contrast to somebody who doesn't have mild cognitive impairment, who has probably a 1 to 2% chance per annum of developing dementia. So it does increase your odds of heading down that way. It's also known as something called a minor neurocognitive disorder. Now, dementia has been sort of rebranded, if you like, in the last number of years, and is known as a major neurocognitive disorder. However, mild cognitive impairment is a minor neurocognitive disorder. So just if you come across that term, they are really synonymous here. And the big difference between mild cognitive impairment and subjective cognitive impairment is that you do see objective deficits on testing. So you may or may not be aware of the problems yourself. It's not uncommon for me to actually see a married couple and the spouse is saying, well, yes, my husband and my wife are having all these problems and not remembering things, etc. And then the person themselves says, no, I'm absolutely fine. So you may actually not be aware of these issues yourself, or you may be, but the key thing is you actually can pick up the deficits on some sort of cognitive testing attempt. The big difference between mild cognitive impairment and dementia is that there is a lack of functional impairment. So in dementia, we expect the cognitive problems to cause issues with day-to-day activity. You cannot complete your normal tasks without problems. In mild cognitive impairment, you do have some problems, but you can compensate for them. Slightly confusingly, you can have some very subtle problems in mild cognitive impairment of an executive nature, but I think it's probably easier to consider that there's no major functional impairment. Now, we then tend to divide up mild cognitive impairment into this thing called amnestic and non-amnestic. Amnestic really relates to amnesia, so a particular memory issue, and non-amnestic may be related to one of the other cognitive skills, whether it's language or executive function and so on. And the applicability of these is that they can actually make it more or less likely that you will actually develop one kind of dementia rather than another. So amnestic MCI, perhaps unsurprisingly, is more likely to develop into Alzheimer's disease. Non-amnestic MCI may develop into one of the other dementias, whether it's vascular dementia, frontotemporal dementia, and so on. And the other thing to probably bear in mind is that you do have this amnestic MCI, the main issue is with memory. It is more likely that you're going to go on to develop dementia in general compared to the non-amnestic MCI. So as I mentioned before, there's this increased risk annually of developing dementia if you have MCI. Of course, 10 to 15% per annum means that the majority of people, significant majority of people, will not develop it year on year. But of course, if you take that over a period of 3 or 4 years, you are looking at around sort of 40 to 50% of people potentially develop dementia. So it certainly is a risk factor. And my approach to MCI really, when I see people with this condition, is I say, well, you need to be alert but not alarmed. Now, alarmed because it isn't inevitably going to develop into dementia, but you need to be alert to the fact that it's there and it is a risk factor, and also that there are certain things that you can do to improve the chances of it not developing dementia often. So these would include things that are in general good for your brain, and we have good evidence that some of these things actually do reduce the risk of the development of dementia. So exercise is a key thing, and I'll be talking about that in another video. And optimizing vascular health is another very important thing as well. So that's looking after things like your blood pressure, your blood sugar, your blood cholesterol, and the health of your heart in general. Reducing stress is, I think, also very important, and we know that stress, it can have a very negative effect on the brain. Even structural changes can result from stress, and so that's an important part of managing MCI. And dietary changes can also have, I think, a significant impact as well. Again, I'll talk about this in another video. I think most of the evidence really talks about sort of Mediterranean style diet, or another one called MIND or MIND diet at the moment, but that's a complex topic. And then the last thing is continuing to engage in complex mental activity, which is really stressing your brain gently so that you're pushing its sort of limits a little bit, and the brain then responds in an adaptive way to that. So we need to be alert but not alarmed if we have mild cognitive impairment, and there are certainly things that we can do to reduce the risk, hopefully, of it developing into dementia.